The opioid crisis affecting the nation is now a public health emergency after a declaration by President Trump this afternoon. It seems like it's been a big problem in the Cape Fear, and this morning Governor Roy Cooper was here to discuss it. WWY's Basil John spoke with the governor, and he also spoke to others about the nationwide epidemic.
As President Donald Trump declares the opioid crisis as a threat to the country.
This epidemic is a national health emergency.
Governor Roy Cooper continues his work to combat the opioid crisis throughout North Carolina.
The Wilmington area is ground zero for this problem. I wanted to be on this national six-person commission and was appointed by the president. This has to be a bipartisan approach.
Governor Cooper was here for a drug overdose prevention training session for law enforcement officers. He also held a roundtable discussion on the opioid crisis to get more information about the epidemic in our area and to help develop the opioid action plan in North Carolina. The governor says actions from D.C. have made the fight hard.
Over the last few months in Washington, they've been considering health care plans that remove millions of people from health insurance. You're going to lose the fight against opioids if we don't get people insured and we don't provide them with the treatment that they need.
Jesse Bennett overdosed on opioids in the past. He now works with Harm Reduction Coalition and says nothing will get done without proper support.
Part of the issues we have in approaching this from a public health issue is the lack of funding for syringe exchange programs and naloxone as well.
The organization's executive director, Robert Childs, says to combat the crisis, it needs more than a declaration.
I think declaring an emergency and not putting any funding or resources or legal reforms behind it, that will definitely be lacking if that investment isn't put in there.
In Wilmington, Basil John, WWAY News.
Governor Cooper says he will meet with his Secretary of Health and Human Service to determine what President Trump's designation of the opioid crisis means and how it will help the state go forward.